Hey, loves. I just wanted to come and drop you guys an update on preparation for thyroid surgery. So, last week I went for my pre op. I went and talked to the ENT surgeon to find out, you know, what we were doing, ask some questions about the procedure, who's performing the procedure, who's attending physician, all those things to make me feel comfortable. And so I did leave feeling uh, comfortable. I was comfortable before, but I like to get the feel of the overseeing physician. So we talked a little about surgery, what to expect. We did another sonogram. Why do I always get those confused? We did another sonogram of my thyroid. And lo and behold, she did notice on this scan that the nodule that's in my left node is a lot closer to the nodule that's in the isthmus. And for those of you who don't know the background, I've been following my thyroid nodules for some years now, and they're all relatively small, too small to even have biopsied. But there's one that was characteristic of being potentially cancerous. So we went ahead and biopsied and found it has papillary thyroid cancer. The cancer is papillary thyroid carcinoma in that nodule, which sat on the isthmus of the thyroid. So we planned to surgically remove the isthmus only, leaving the two lobes, hoping that that would not cause need for me to have thyroid replacement hormones. Well, after the pre-op surgery, and we did a second, or not a second, but another sonogram, those nodules are very close together and leaning more toward the left side of my thyroid. We were trying to see if it was because of the way that my neck was positioned, if the positioning changed the look of the location, but it really didn't seem to make a difference how I position. So with that being said, we will now need to move both the isthmus and that left lobe due to where it sits in the thyroid gland. So I'm not happy about that because that means that potentially I will need thyroid replacement. If not now, maybe in the future, but I mean, there's still a possibility of not. So we'll be monitoring, of course, my hormones moving forward to see how my body responds with those two areas of the thyroid being removed. Hoping it kicks back in, but because I am currently approaching 50 and almost in menopause, that concerns me. And my true concern is like anything that is going to contribute to increased hormonal influxes, which means mood swings, brain fog, as you can see, and hot flashes. You know, all of those things that come with aging gracefully. I'm hoping that it doesn't impact those things and so that they're not worsened in any way. And also the fact that I have an autoimmune disease. So with Sjogren's, any surgery can really throw your immune system out of whack and cause, with the inflammation, it can cause a flare, which causes all these other issues. So it's a lot, but we got to do what we got to do. So I look forward to getting this done and getting it behind me and hopefully things leveling out and going back to a normal base. In preparation, like any other surgery, you show up at your scheduled time. You don't wear jewelry. You don't wear makeup, any aesthetics. And that's really it. You have to stop certain medications depending on what you may be taking. Definitely no blood thinners. And that's really it as far as preparing for day of surgery. Expectation for surgery time is 3 hours, start to finish. And so that includes the pre-op stages, and then of course the rest and recovery afterwards. And this is an outpatient, considered an outpatient procedure, because they will monitor after surgery, make sure everything is okay, and then you can go home if all is well. And downtime, I'm being told 1 to 2 weeks, 1 week definitively with, nothing strenuous that would cause any strain, of course, on your neck, your thyroid area. And then I've heard people say recovery is pretty quick, usually with thyroid surgery. So yeah, that's where we are. And so I will try and document as much as possible and share with you my journey. And then, of course, keep you updated on how my recovery goes. And I don't take surgery for granted. So, provided all goes well, I will see you guys on the other side. I am confident and prayerful that everything will go okay. But in case it doesn't, like I said, I don't take it for granted. Anytime you are going under anesthesia and you're having a procedure where someone is cutting into you, you never know what's going to happen. So I just pray that all goes well. The only potential hazards, I guess I could say, with this surgery are that the laryngeal nerve can be affected by surgery. So my voice is already jacked up due to my voice box thyroid, whatever is causing it. So I definitely hope that that's not an issue. But I know a lot of people have voice changes after thyroid surgery where there's a hoarseness. And like I said, I'm already going through that. And then, of course, you have the parathyroid hormone, or the parathyroid gland, I'm sorry, that is sometimes affected because that is your calcium producing gland. And if hypocalcemia happens, it can be life-threatening. So that is something that they'll monitor as well after surgery, make sure there are no issues with my calcium production and such, and make sure that the levels of other hormones are okay. So. And of course, infection and bleeding are always a risk when you're going into surgery. But outside of that, hopefully I don't have any of those issues. All goes well, and that I see you guys, or you see me, back here soon. All right. Y'all stay tuned. If this is content that you're interested in or you think someone could benefit from, please share it or like and subscribe. And I'll try and start creating that brain fog. I'll start trying to create playlists so that I can categorize my videos for those who are interested in some and not others. You can go to the playlist and watch the ones that you're interested in. All right. So hopefully y'all have a wonderful day. Stay blessed, stay centered, stay grounded, and I love you all. Bye-bye.